Diversity in healthcare. The Hospice and Palliative Nurses Foundation has received generous philanthropic support to develop a series of online educational training videos for hospice and palliative care nurses, tailored to cover fundamental considerations for caring for patients of various faith backgrounds. End-of-life care means more than treating physical symptoms. It extends to a patient's psychosocial, existential, and spiritual needs. Fostering trust is vital to the care of the patient and family during difficult times. In today's changing climate, it is important that we continue to learn about cultural differences. The payoff is significant. Culturally sensitive care builds trust and rapport with patients and families, increases treatment adherence, and opens the door for continuing education about important health matters within all communities. As a part of our series of diversity in healthcare videos, this video was made possible through a grant from the Jack Buncher Foundation. Think about someone you know you interact with regularly that has different religious beliefs from your own. When you interact with them, are there things you do differently that you might with other acquaintances with whom you share religious beliefs? Perhaps the topics you discuss, the places you eat, and the questions you ask differ. Can you think of a time when you cared for a patient with a faith tradition you knew very little about? Religious and spiritual beliefs are something many people cherish, and while we do not all share the same beliefs, respecting each other's beliefs is important in your work. In this video, you'll learn some of the basic beliefs of the Hindu religion and the implications those have in healthcare. Throughout your life, you've probably met or at least seen people who practice the Hindu religion. It would be difficult not to be acquainted with at least one or two, since there are 1.2 billion Hindus worldwide. Another way to think about this is if the world's population of 7.7 billion people was reduced to a village of 100 people, 31 would identify as Christian, 24 as Muslim, and 15 as Hindu. These are the three most common faiths. What do you already know about Hindu beliefs and practices? Have you seen any of their rituals or studied their beliefs? What do you know about how their beliefs affect their preferences for care at the end of life? Let's review some basic Hindu beliefs. First, Hindus believe in God, who maintains the universe with the assistance of various deities who personify a range of cosmic powers. For example, Brahma, Shiva, and Vishnu represent creation, destruction, and preservation, respectively. People that practice the Hindu religion believe that a person's soul, or Atman, is immortal. They believe that when an individual dies, their Atman discards the physical body and transmigrates from one life to another, somewhat like a person changing their clothes. For a Hindu, the goal of life is freedom from this cycle of transmigration to reach a state of eternal devotion to God. This is known as moksha. Their progress towards moksha is influenced by both the grace of God and the fruits of their past actions, known as karma. Variations of these beliefs exist throughout Hindu communities, but these beliefs are central to most, if not all, Hindus. How do you think these beliefs affect a person's view of their death or the death of loved ones? Of course, Hindus grieve the death of their loved ones, but their faith reminds them that birth and death are accepted as inevitable realities of life. Hindus may view illness and death as an opportunity for spiritual growth in pursuing moksha. The Hindu faith is rich with religious practices, many of which can impact the way you provide care for your patients. Let's explore some of these practices you may encounter and discuss appropriate questions you can ask to find out how each patient would like to receive care related to these beliefs. Practicing Hindus have clothing and markings that are significant to their religion. They may have a marking on their forehead called the chandlo, tika, or bindi. This marking can mean different things. It can be used to invoke the blessings of God, or it can also be a symbol of insight and spiritual awareness, or it can indicate marital status. Women may wear red pigment along their hairline, known as sindur. This practice is associated with the wedding ceremony and symbolizes a woman's connection and commitment to her husband. It is an important part of many married women's identity in Hindu culture. Hindu patients may wear different necklaces or sacred threads, either on their wrist or that run from their left shoulder to under their right arm. The significance of these objects will vary depending on the ritual context. For example, married women will also wear a Mangalsutra, which is a necklace typically made of wood, gold, or diamonds that has a pendant on it. Traditionally, she would have received this necklace from her husband during their wedding. They believe it is a symbol of the couple's commitment, love, and respect for each other. Outside of a medical emergency, you should never remove a Hindu's attire or symbols without permission because of the religious significance these objects have. If such attire or symbols are not visible, you may find it helpful to ask, are there any cultural or religious symbols or attire we should be mindful of while caring for you? Patients and their families will appreciate your respect for these significant symbols they hold sacred, even after the patient has passed. Another common religious practice is offering prayer. Before accepting food or even medications, some Hindus may prefer to bathe in the morning prior to offering prayer. This practice of prayer may influence the timing, procedures, or medications and is best clarified proactively. You may find it helpful to specifically ask, is there anything I should know about your worship and fasting practices to help us schedule your medications and other procedures? Fasting and dietary restrictions vary among Hindus. Some may not eat meat, fish, or eggs. Others may also avoid onion, garlic, mushrooms, or peppers. It's always a good idea to ask, what are your dietary preferences? What foods do you avoid? And do you practice fasting? How can we support you in fasting? Knowing a patient's fasting habits can help you create an optimal and safe schedule for their medications. Because Hindu patients may follow a diet that precludes non-dairy animal products, you should clarify the patient's preferences regarding animal derivatives and medications, such as gelatin capsules or porcine heparin. You could say to them, some patients' dietary preferences may conflict with common ingredients found in certain medications, such as gelatin capsules. Are there any such restrictions we should be aware of for you? This will help you provide what the patient needs while respecting their religious practices. The Hindu religion has several rituals important at the end of life. These rituals are believed to facilitate the soul's exit from the physical body. Some of these rituals include placing a tulsi leaf or drops of sanctified water on the lips of the dying patient. Others include listening to devotional music, chanting a chosen mantra, or having space to place sacred images of deities known as murtis. Some patients may prefer a particular positioning of the body, such as placing their head toward the north or east, or being placed on the ground to symbolize the physical body's return to Mother Earth. It is important to reiterate, do not remove any symbols and necklaces without permission. For these and other rituals, it may be helpful to find out if the patient would like to involve individuals from the local faith community, family members, friends, or chaplains. You can ask, is there anyone from your faith community you'd like us to contact? Sometimes people get so sick that we can't talk to them about their care, which is why some patients may prefer to also involve family members and others in medical decision-making, especially near the end of life. It may be helpful to ask, who in your family or community should help us make decisions about your medical care? Have you completed any documentation to identify these individuals? If the illness is so severe and we worry that it might take your life, are they aware of your preferences surrounding care at the end of life? Also note that when a patient needs to discuss sensitive health issues or receive physical exams, elderly Hindu adults may prefer working with a clinician of the same gender. As the Hindu patient nears the end of life, they may prefer to die at home. This allows them to be in a familiar setting with family and friends who can help facilitate rites and rituals. The Hindu religion does not preclude analgesia and sedation at the end of life, but some patients may prefer to be more alert during their final days with their family and friends. Like any patient you care for, be sure to acknowledge their religious and spiritual beliefs. The Hindu tradition encompasses varying customs, rituals, and practice that can all influence end-of-life care. Be sure to ask them about these practices proactively so you can provide the best care possible.